Hello and welcome to the Pediatric Brain Tumor Foundation's webinar, Navigating Social Skills Challenges After a Pediatric Brain Tumor Diagnosis. My name is Kathy Riley. I'm Vice President of Family Support for the Pediatric Brain Tumor Foundation. We're so honored to have you joining us today for this important webinar. The PBTF provides programs and resources to support families facing a pediatric brain tumor diagnosis throughout their journeys. We'll provide links to some of those programs and resources at the end of today's webinar. Before we get started, I have a few guidelines to review. You are muted for this webinar and your video is disabled, but we welcome questions during and after the opening remarks. Please type your questions into the Q&A feature found at the bottom of the Zoom window. We'll not get to every question today, but try to answer as many as possible. Today we'll hear from our presenter, and then Heather Held, our National Family Support Programs Manager, will host the Q&A portion of the webinar. And if we could go to our next slide. Victoria Willard is a licensed pediatric psychologist and assistant member in the Department of Psychology at St. Jude Children's Research Hospital. Her research program focuses on social emotional development in children with cancer. She has particular interest in the impact of diagnosis at the key developmental stages of early childhood, adolescence, and young adulthood. Much of her work to date has focused on identifying the factors that influence social functioning and peer relationships in children with brain tumors to find opportunities to intervene. It gives me great pleasure to introduce Dr. Victoria Willard. Dr. Willard?
Thank you so much, Kathy, for that introduction. And I am so honored to be here with all of you today with the Pediatric Brain Tumor Foundation. Social skills challenges after a brain tumor diagnosis are very near and dear to my heart and has been a focus of my work. And so I'm really excited to talk through some of that today. Next slide, please. So today's objectives are as follows: to gain an understanding of why children with brain tumors may struggle socially after treatment, to explore some social skills interventions aimed at improving competence and quality of life, to describe some key practical strategies for how to cope with social skills challenges, and then to describe some tools and resources available for survivors and their families to help them navigate these challenges. Next slide, please. So as we talk about social functioning, I think it's really important for all of us to have a common definition and common language so that we're all on the same page. This is a very simple definition of a topic that can be quite complex, but I like the way that it gets to the meat of the construct. So for my purposes, social functioning is the ability to interact competently with others across settings. Interactions typically involve same-aged peers and really form the basis for interactions throughout the rest of a child's life. Competence in these interactions is critical to both present and future well-being of a child and ultimately an adult. Next slide, please. A broader term that is used a lot in the media and schools right now is social emotional learning. A national organization known as CASEL, or the Collaborative for Academic, Social, and Emotional Learning, defines social emotional learning as the process through which all young people and adults acquire and apply the knowledge, skills, and attitudes to develop healthy identities, to manage emotions and achieve personal and collective goals, to feel and show empathy for others, to establish and maintain supportive relationships, and to make responsible and caring decisions. There is an understanding that these skills must be taught, that they apply in multiple contexts, and that our understanding and implementation of these skills is different across developmental stages. Social emotional learning is very much a lifelong process of learning how to better understand ourselves, to connect with others, and to work together to achieve goals and support our communities. There are 5 main goals that are at the core of social emotional learning. They are self-awareness, self-management, social awareness, relationship skills, and responsible decision-making. Next slide, please. So these 5 skills are known as the CASEL 5. Self-awareness is the ability to understand one's own emotions, thoughts, and values, and how they influence our behavior across contexts. So in order to truly interact with each other and to do so well, we really need to understand our own emotions and what we're feeling and why we're behaving as we are. Self-management then is the ability to manage those emotions, thoughts, and behaviors effectively in different situations. So to understand that even though we may be feeling one thing, it may or may not be appropriate to exhibit that behavior in a given situation. Such as when we're feeling really angry, it may or may not be appropriate to demonstrate that anger in certain ways in different situations. Then social awareness is the ability to understand the perspectives of and to empathize with others, including those from diverse backgrounds, cultures, and contexts. Relationship skills are the ability to establish and maintain healthy and supportive relationships and to effectively navigate settings with diverse individuals and groups. And then finally, responsible decision-making is the ability to make caring and constructive choices about personal behavior and social interactions across different situations. Next slide, please. So how these and other skills are developed, learned, and demonstrated by a child will vary significantly by the age of that child. A social competent interaction will look very different in a 4-year-old as compared to a 16-year-old. We should have very different expectations for what social interactions and peer relationships will look like at different ages. While there are some behaviors that are acceptable when kids are young, they are no longer acceptable or appropriate as these kids get older and could very much be a source for difficulties with peers. As an example, just a few weeks ago, we had a patient in for our studies who was in late elementary school, 4th or 5th grade, and that child brought a stuffed animal to appointments and used that stuffed animal to answer questions. Now, this is a behavior that's really cute and adorable in a 4, 5, 6-year-old preschooler, but for a late elementary school kid, we had significant concerns about whether this was also happening during the school day, as this could really be a source of ridicule and teasing from for that child. So next slide, please. Along with the age of the child currently, it's also really important to think about the age at which the child was diagnosed with a brain tumor or with cancer. Given that skills are developed at different ages, the impact of a diagnosis on social functioning in early childhood will be very different than a diagnosis that occurs during adolescence. If we think about how skills are developed and when the disruption in skill development happens over time, if you're older at diagnosis, you've learned and developed a lot of the skills that you need to be socially competent, whereas if that diagnosis occurs earlier in life, there's more risk factors and for delays in development. Next slide, please. So as we start to think about brain tumors specifically and their social challenges, I really think it's important to remind us all of a couple of key points. And I know a lot of this information won't be known to many of you, but again, it's helpful to be on the same page. So brain tumors are our most common solid tumor of childhood. They are the second most common cancer diagnosis after acute lymphoblastic leukemia. Unfortunately, brain tumors come with a host of late effects in numerous domains, including those in neurological, endocrine, neurocognitive, and psychosocial. There has been significant literature over the last 20 to 30 years on the characterization of an intervention for neurocognitive concerns specifically, but unfortunately, understanding of social outcomes has really lagged. Next slide, please. So to dive a bit into the research, long-term data from the St. Jude Lifetime Cohort and other large national and international follow-up studies tell us that survivors of pediatric brain tumors do not achieve the social milestones of adulthood: employment, education, independent living, and romantic relationships at the same rates as their peers or as survivors of other childhood cancers. And while neurocognitive concerns certainly play a role in this, these milestones are quintessentially social in nature. They involve relationships with others across multiple settings. Next slide, please. If we back up to adolescence, and this is data from the Childhood Cancer Survivor Study, we start to see the prevalence of these concerns, with parent report of weaknesses in social functioning apparent in about 50% of our survivors. Next slide, please. In typically developing children, social functioning is oftentimes assessed in the classroom. Specifically, kids in a classroom are given a list of their classmates and are asked to cast them in a play, with the roles then linked to different types of interactions with others. As can be seen here, children compared to classmates, children with brain tumors are viewed as less popular, less aggressive, more isolated, and more likely to be victimized than their classmates. Notably, however, if you ask brain tumor kiddos to rate themselves, they often consider themselves to be popular and not victimized. So there's this disconnect between the way that these kids are viewing themselves and the way that kids in their classrooms are viewing them. So the question for me here really becomes why? Why do survivors not meet long-term development milestones? Why are they left out at school, teased, or victimized? Why do they not recognize these issues? And then how does that really impact their position in the social hierarchy? The why is what I'm particularly interested in, as in my mind, until we can answer these why questions, it's really hard to go about fixing them. Next slide, please. These why questions have led to the development of theoretical models that attempt to break down the components of social functioning into the factors that contribute to outcomes. This model is one that I've adapted and have used to think about social functioning in brain tumor survivors. Essentially, it involves two skill-based domains here in the middle. Neurocognitive factors such as attention, working memory, processing speed, and executive functioning, and social cognitive factors, social skills like affect recognition, theory of mind, communication, and problem solving, that contribute to social experiences or the day-to-day social interactions that kids engage in. Affective experiences then involve aspects of emotional functioning that may contribute to social experiences. Things like whether a child is anxious or lonely or perhaps even hyperactive. All of this can influence their ability to interact with other kids. Finally, medical factors on the far left, such as a history of radiation therapy, tumor location, neurological late effects like seizures, hearing loss, or endocrine concerns like short stature or obesity, may then also influence social outcomes. Next slide, please. So a lot of the data that I have been collecting over the past few years is done under this model. Unfortunately, this data is not yet published, so I don't have specific graphs or figures to share with you, but I do want to talk you through what we are seeing. Next slide. First of all, as you likely know, and as shown by significant research, survivors have weaknesses in neurocognitive functioning. And these weaknesses absolutely play a role in their social functioning. As you might expect, social interactions happen very quickly and can be very complex. A lot is communicated in a very short time. Children who have difficulty paying attention or think a little more slowly than their peers may struggle to keep up with social interactions. So if they're in a conversation with a group of children and a lot is happening all at once, with differences in facial expressions or subtle shifts in the way that kids are talking to one another, they really may have trouble keeping up with those aspects. And so by the time they figure out what was said, these kids are on to something else. From an intervention standpoint, we have actually seen some improvements in social functioning with some neurocognitive-based interventions, most notably when stimulant medication is used. Next slide, please. From a social cognitive skills standpoint, by far the most data that we have is on affect recognition. Survivors of brain tumors struggle to identify facial expressions as compared to typically developing children. We see that they do okay when asked to identify most positive expressions, as well as expressions that are more obvious or intense. But they struggle with subtle negative emotions. And so if you're thinking about an interaction where perhaps someone has a polite smile on their face, but they're really trying to end a conversation with the person they're with, that survivor may not pick up on the subtleties and have difficulty understanding a polite smile of someone who's ready to end a conversation versus a smile of more significant enjoyment. We also have some emerging data that about 40% of survivors are struggling with theory of mind or perspective taking. So they may have trouble with figuring out what someone else is feeling or thinking in a situation, and instead may just believe that whatever they're feeling, the other person is feeling. So they feel, hey, I'm enjoying talking to this person. They must be enjoying it too. So I'm just going to continue going along in this conversation, not recognizing that that person may actually not want to talk about that topic or may need to go do something else. Finally, we're also starting to see some weaknesses in problem solving or figuring out what to do in a challenging social situation. For example, we asked kids what they would do if they were in a situation where they were trying to play with other kids, but those other kids weren't listening to them. We're seeing that they would choose to either ask an adult for help or would just wait until the kids eventually paid attention to them. Neither of those are great options and may indicate some difficulties in understanding how to navigate these difficult social situations. Next slide, please. Finally, from parent report questionnaires, we start to see the consequences of these social skill-based weaknesses. As compared to norms, parents report that their kids are experiencing more rejection from peers and fewer positive peer interactions. We also see reports of less social awareness and reduced social motivation. So kids are viewed as being less aware of these social interactions with others, as well as potentially less motivated to engage in social interactions with their peers. Ultimately, all of these weaknesses are not going to be seen in every child with a brain tumor, but from a general standpoint, it does start to give us a constellation of skill deficits and symptoms that we can start to tease apart and focus on as we're developing interventions. Next slide, please. So in one of my current studies, part of our social functioning assessment involves asking elementary school age survivors if they had a best friend. Next slide. About 20% of survivors could not identify a best friend when asked. And this simple question actually led to some interesting differences. Next slide. First, those who could not name a best friend reported lower social competence and self-worth than those who could. This suggested to us that while these kids may struggle to understand their place in the classroom social hierarchy, they are at least partially aware of their social difficulties, at least when it's as obvious as recognizing that they don't have a best friend, but most kids do. Next slide. But perhaps most importantly, the parents of those children who could not name a best friend reported engaging in fewer behaviors that would support friendships, things like arranging play dates. To me, this really calls for a potential intervention target. That interventions can focus on helping parents to become more actively helping their kids engage in social interactions. Now, I don't mean that we need helicopter or bulldozer parents who are overly involved in their children's lives, but I think when coupled with some of our other data, there's a risk that our brain tumor kiddos don't have the same social initiative as other kids, that they may be more comfortable in their own spaces and aren't necessarily going to go to mom and dad and ask for a play date to be scheduled or to sign them up for a soccer team. Instead, we may need parents to create those opportunities, to get them involved in some extracurricular activity or some club at school, or to set up get-togethers with other parents who have similar aged kids. We'll talk about this a little bit more as we go along. Next slide, please. So let's talk intervention. Unfortunately, the research literature on social skills interventions for survivors of pediatric brain tumors is really limited. A couple of years ago, I wrote a paper that reviewed the 9 intervention studies that had been done to date. There may now be 10. Unfortunately, these interventions would really all be considered failures. All struggled to recruit families as they were in-person and group-based, which is really difficult for many of us, and especially during times of COVID. They also struggled to identify any changes in functioning after the intervention, as we haven't had great measures to assess social functioning issues. As such, at this point, these are not interventions that I would recommend to families or survivors myself. That said, I would like to talk about 3 key aspects of these interventions and the field in general that those of us who are doing research in this space are really focused on to ensure that future interventions are hopefully stronger, more successful, and worth recommending. Next slide. First, our outcome measures for social functioning are weak. Kids with brain tumors often fall within normal limits on questionnaires. However, parent interview reports in comparison to those more sensitive school-based measures do suggest significant concerns. As such, a secondary aim of my studies has been to try and find better measures that are more sensitive to the issues that we actually see. And the data that I discussed with you all earlier is a step in the right direction. The measures that I am using now are newer, they're more skill-based, they're more objective, they're more focused, and none of these measures were used in any of the prior intervention studies that were done. So the hope is now is that we can actually identify those kids who actually do have deficits and can enroll them in an intervention and hopefully target some change. Next slide. The second aspect is that most of the interventions were given to a really wide age range, often kids at ages 8 to 16, with no written consideration of the different developmental issues that these kids may be facing. As I discussed earlier, the social interaction needs of an 8-year-old are very different than a 16-year-old. We can't intervene with them the same way. We need to have different targets, different ways of intervening, and different focuses on skill development. Next slide. And then finally, all interventions were group-based, in person, and for those off therapy. Given the distance from the hospital that most patients live, especially here at St. Jude, where our families come from everywhere, other options really need to be considered, especially those that make use of technology. If group-based modalities are used, it may actually be beneficial to offer them to patients who are on therapy, and thus really have a more preventative approach to a captive audience. Next slide. All right, so since there's very little that I could offer for intervention from a research perspective, I thought we could spend a little bit of time talking about some practical recommendations for addressing social skills challenges with kids with brain tumors. These are tips and recommendations that I use clinically when I'm working with families, and also things that I've recommended to other practitioners who are seeing these issues in their own patients. So next slide. As I mentioned earlier and keep mentioning, it's so important to consider the age of a child that you're working with or parenting when it comes to social skills challenges. And a good place to start is to become more aware of what kids their age are focusing on from a developmental perspective. So your early elementary kids, your kindergartners, your first graders, your second graders. This is when friends really start to become very important. These kids want to be liked, they want to be accepted, they want to be more independent, they want to have those peer interactions. So this is when you really start to see those opportunities for play dates and different types of extracurricular activities like adorable kids soccer teams when they all chase the ball together. This then gets stronger in your middle elementary kids, your third, fourth, and fifth grade kids. These kids are developing stronger and more complex friendships, but they're also experiencing increased peer pressure, more body awareness, and a stronger sense of what is different. This trend continues into middle school, and now we add in hormones and dating, which just makes things all the more complex and interesting. Next slide. So as you're thinking of elementary and middle school kids that you know, here are some things to consider. As I talked about before, parents will really may have to take a much stronger and more active role in facilitating these things than they do with other kids, even other kids in their own families. So help kids with similar interests to find each other, help survivors to join clubs, to find interests or hobbies, enroll them in sports, in lessons, in youth groups. There are lots of different opportunities and places to find friends. It doesn't just have to be in school. It can be in your neighborhood. It can be through your church. It can be through community-based activities. And really thinking and supporting and promoting social interaction the way you do schoolwork. Have conversations with your kids about social skills. As you're watching TV together, as you are reading books together, talk about friendships, talk about the ways that we interact with people. Help them to model and understand, have them, as you're watching videos together, what are the different ways that how are these kids interacting? Why do you think they're friends? What do you think makes a friend? What makes a good friend? How do we go about finding them? Have these conversations with your kids. And then also encourage school attendance. I think so many times when we think about school and we think about kids who are struggling in school, especially socially, sometimes our instinct is to pull them out of those spaces. But so much of school is the social interaction and not the instruction. And I think that became all that much more apparent over the last year and a half with COVID and lockdown and virtual schooling. These kids need those daily, easy opportunities to practice and interact with each other. And kids who are homeschooled or virtual learning just don't have those same opportunities for interactions in the same way. If homeschooling is the way that you find you need to go, really think about upping opportunities for social interaction. Some homeschool networks have things like field trips and play dates and other sorts of things that can be helpful to help kids get to know each other and find each other. But really, school is social interaction, and kids need that kind of day-to-day practice in doing this. On a related note, speak with schools about social skills. Social skills development can be part of a kid's IEP or 504 plan. Many schools do have social skills groups or other interventions that they have already developed and implemented for kids in their school with social skills challenges. There are other kids besides brain tumor kids who have social skills challenges, and a lot of the interventions that are being done in schools already would be very effective and helpful for kids with brain tumors. Some of the issues that kids with brain tumors have are different, absolutely, but the ability to practice and teach and learn social skills through interactions with others is pretty universal. Next slide, please. So things get more complicated socially when you think about the teens and 20s. Peers become increasingly important, as does developing independence and dating. Decisions must be made regarding schooling, jobs, independent living, and so much of this involves social skills and social interaction. So there's a lot of space for intervention and teaching and practice, and it's hard. I'm not going to say that it's not, because it is. Next slide. So again, help kids and teens with similar interests to find each other, encourage participation in clubs and sports and youth groups, finding part-time jobs, different ways that kids can practice. Again, working with schools to do this. Begin to foster independence with self-care and medical tasks, as this will be a big part of them becoming independent. Think about school attendance. Again, and then early discussions about post-high school steps. Extended high school, jobs versus college, whatever that may be. High school goes really fast, and all of a sudden you have an 18-year-old living in your house. So it's good to start having these conversations as early and as frequently as possible, and thinking really creatively about ways to do this. So next slide, please. So with all of that, I did want to leave you all with 2 book recommendations. I have no affiliation with these books at all, but I do enjoy them. They're probably best for your school age kids, but may have some relevance for teenagers as well. They're very easy reads. The one on the left is a specific guide for kids to be read with their parents. It involves little comics of a cat and a dog. It's super cute. And kind of talks about ways to practice social skills and to practice interacting with other kids and to deal with challenging social situations. And then the book on the right is specifically designed for parents and talks about different types of kids who might have different types of social skills challenges. So your kid who is more impulsive, or your kid who is more dysregulated, and different ways of focusing on that. So these are both available on Amazon and other bookstores, but they're 2 that I am starting to recommend to families and have really enjoyed. So next slide. With that, this is my contact information. Certainly, looking forward to the question and answer session, but also willing to continue conversations offline and after today's talk. Next slide, which is my last one. And I will thank you all for listening to me today. And I will turn it back over to Heather.
Thank you so much, Dr. Willard, for your presentation. I think I can go back and watch this 3 more times and pick up something new every time. So much information. My name is Heather Held, and I am the National Family Support Programs Manager for the PBTF. And it gives me great pleasure to introduce to you today two parents who will join Dr. Willard to answer questions from all of you. We really feel that these parents offer a valuable perspective on the panel as experts in their own child's journey, knowing firsthand the unique challenges that families face during treatment. Jeannie Carlson is mother to 26-year-old Sarah, who is diagnosed with a germinoma brain tumor at age 8. Throughout their brain tumor journey, the family has always looked for ways to support Sarah academically and socially. Jeannie also focuses on giving back to others on their journeys when possible, having supported the PBTF at in-person programs in California and currently serving as a peer mentor in the PBTF's peer mentoring program. Professionally, Jeannie worked in the biotech industry and retired in 2020. Lucia is mother to 2 teenagers, one of whom is a brain tumor survivor. Like Jeannie, Lucia gives back to others along this journey. She is the parent leader of the PBTF Spanish language parent support group, as well as 2 English-speaking virtual parent support groups. Professionally, Lucia is a psychologist specializing in families and children who have experienced trauma. So, Jeannie and Lucia, if you would please go ahead and turn on your video and unmute yourselves. We are now going to welcome some questions from all of you. You can type questions you have into the chat feature at the bottom of the Zoom window. And we've already received some questions from registration, so we have those as well. And I am actually going to start, Dr. Willard, with you. The first question we had today was, does this data that you shared include children with benign tumors, not treated with chemo or radiation, just surgery?
Yes, absolutely. So all of the data does include kids who are treated with all different modalities, from surgery only up to and including radiation, chemo, and surgery, and everything we have thrown at these poor kids. And we find deficits and concerns in kids who are surgery only. I think when you think about the impact of a tumor on the developing brain, even if it is a benign tumor, it is still in there and pushing things around and disrupting development in a way that a benign tumor in a leg or an arm would not. So I have always made it a point to include kids with all types of tumors in my studies, because I think that's really important to understand what even our surgery-only kids are struggling with.
Thank you for that. I'm going to throw one more question to you right now. And this one is affect recognition or other social skills better when you compare the age groups, i.e. high school versus grade school, because the kids theoretically are more developed and starting from that higher foundational level?
Yeah, that's a really great question. And while most of our research in affect recognition has been in kids who are diagnosed younger, so often kids who are diagnosed probably before the age of 10 by the time we get to them in research studies, I would say that because this is a developing skill, that your kid who is diagnosed when they are 15, 16, 17, 18, they've already got some great social skills on board. They know how to interact with people. They know how to kind of read some of those subtleties. And so those same types of disruptions to their social skill development or their neurocognitive development, for that matter, are not going to occur. What we know about kids with brain tumors and the development of these weaknesses is that kids don't necessarily lose skills that they had. So a brain tumor diagnosis, if you know your ABCs, a brain tumor diagnosis is not going to take away your ABCs. You still know those. But it's just going to be slower to learn those the new skills as kids get older. And so, our kids who are older at diagnosis, who had all of those normal kid opportunities before they came into the hospital and had their diagnosis, are likely to be in a better position socially.
Jeannie and Lucia, I am going to throw this to the two of you. Lucia, I'll go ahead and start with you on this one. How did you determine the best school for your daughter, where a new school may have more academic supports for them versus keeping them at a school where they have been since diagnosis and have established relationships?
I would say that that was a tough call to make, given that we did move her to a different high school. And the reason why we did that was because her older brother was going to that same high school, and we figured having her brother, and also, when Dr. Willard was talking about an established group or program that would be helpful, we really encouraged her to be a part of the band. And this band program, band in general for most high schools are very, very inclusive, and they're very supportive. They spend a lot of time together, and I figured this would be a good opportunity for her to have an established group to do things with, to get to know her in a really supportive way. They spend a lot of time nurturing skills, and we figured that this would be a good program for her to be able to thrive, even though school is really tough. And in her classes, she has special classes and an IEP and all of that, but having her older brother there to help her, if they connect, because we want him to have his own life too, but just to have this nice net, and then the development of friends in the band, if she needs, if she has a place to eat lunch with, just having these little pockets of places where she feels connected. I think that was the deciding factor for us.
Okay. Jeannie, can you speak a little bit about Sarah's experience in school and how you made decisions for that path for her?
Sure. Sarah was diagnosed and treated when she was 8 and 9 years old. So we spent a lot of time in normal public school and then a private middle school that, they tried to serve Sarah, but they didn't really understand what a brain tumor kid faces and weren't able to meet her needs. And she definitely struggled socially despite the supports we tried to give her. So ultimately for high school, we entered her into a high school for children with mild to moderate disabilities. And that's really been a pivotal change in our family. I support all the talk about interventions and figuring out what you can do to support your child. But ultimately, we feel like socialization should be fun. And if it has to be a chore to teach them skills by rote, it may not be worth it. And at some point, we made the decision to understand that Sarah was a disabled person, along with being a brain tumor survivor. And that opened up a new world, first in high school, where if she'd gone to the public high school, she would have had a one-on-one aide and been in resource classes. And Sarah has an emotional age of 9, so that she would be very vulnerable to the adolescent population in the school. The high school we sent her to had 50 kids in high school, and they had dances, they had proms. She was elected student body vice president in her senior year. She got some more normal experiences because she was in an environment essentially with peers. And since high school, we've carried that further. Special Olympics has been a real advantage for Sarah. We didn't think of it at first, but she's thrived with those peers, and she's rather high functioning related to those friends, and that gives her a sense of pride. So I just really advocate, finding a place where you can celebrate your child's strengths. We gave up making her normal. All the things that Dr. Willard talked about with processing speed, especially with being able to identify how she feels. That's one of the defects from her brain tumor. She can't identify how she feels, let alone how someone else feels. So the fundamentals of social interaction are just organically not possible for Sarah. So other outlets have been really beneficial.
Jeannie, can I just say, I love that you all did that. That sounds like such an amazing decision and support for your daughter to help her find her people. And I feel like that's such a big piece of social interaction. You don't have to be the most popular kid, most of us are not I was not the most popular kid, but it's finding your people. And I think that's so much of what it is. And whether that's one person or two people, whoever those people are, it's finding the people that make social interaction fun. And I think that's what we want for all of these kids.
Absolutely. Absolutely. Tori, I'm going to ask you a question that came in at registration, actually.
Yeah.
What differentiates normal, in quotes, social challenges for teenagers with those of a former brain tumor patient?
Yeah, that's a really great question. And it is a question that we are still trying to figure out the answer to. As we really try to figure out and define the kind of social phenotype that we see in these kids, we've looked at social challenges in other types of kids who might have weaknesses in social skills as well. So kids with ADHD often have difficulties with social interaction, often because they're impulsive or hyperactive. So some of our brain tumor kiddos have some of those same issues. Some of our kids with autism or Asperger's syndrome obviously have social challenges, and there's a real spectrum of those from very severe to less severe. And some of the weaknesses that we see in our brain tumor kids look like some of those more high functioning autism types of kids. Yes, lots of nods. A lot of times in schools, you might see kids who have social challenges because they're more aggressive or angry, and we don't tend to see that in our brain tumor kiddos. They don't tend to be seen as pretty aggressive, almost kind of the opposite in some respects. So there is almost a Venn diagram of social challenges, and I think brain tumor kiddos are right in the middle of overlapping with lots of different pieces, which makes them really fun to work with, but also really challenging.
Thank you for that. Thank you. Yeah, it's those teen years are challenging enough. I think when you throw in survivorship on top of that, yeah, it's definitely absolutely a different group of questions and concerns. Lucia, I want to ask you a question that came in. We have so many questions coming in right now. Any advice for parents on how to educate others on the challenges, both kids and adults?
To educate others about
your child and the challenges that she faces.
You mean in terms of people who they meet, mm-hmm. they come into contact with? Yeah. I guess it depends, in terms of her obviously with the school, having the IEP is necessary because, there are some accommodations that we have to put in place for her. For example, just getting, organizationally, she has a hard time because of her processing speed stuff. So she second guesses herself, and we need to put lots of things in place so that she knows I need to take my backpack, my computer. And so sometimes that makes her a little bit late. And so we have to do some accommodations. So that is essential. But in terms of the, when she started with the band, we definitely let the teacher know and the instructors know that she might get overwhelmed a little easily. And so how to, work with her or make a bit more space for her so that she has a bit of time to regroup and engage and join. So I think it depends. Sometimes I like to, not tell right away to see how she does and to see how she navigates the situation, because she's got to learn some parts of it too, or play or practice the things that we teach her or the things that she learns in therapy. So I guess that's my answer. It depends.
Depends. Okay, thank you. Jeannie, I want to put the next question to you, as Sarah is a little bit older What is the best way to support or find opportunities for social interactions for a child who is entering adulthood with significant social skills challenges?
Well, I think what I talked about before, helping them find their people. With Sarah, Special Olympics was really that key to finding a community that she's ultimately now going to live with. She'll be living in a working environment close by that's supported, and with people with developmental disabilities, people on the autism spectrum, and she fits right in. I can remember when Sarah first graduated from high school, running into a couple of parents from the high school who had children with disabilities, and they were sort of lost because their kids were sitting in front of the TV playing video games for 8 hours a day because they didn't really have a plan. With Sarah, we got her a part-time job. We were very lucky to be able to find that, but that gave her some socialization, and it was interacting with adults. So she didn't have all of that peer pressure of dealing with high school age. You know, high school girls are tough, man, and they move at the speed of light. And Sarah just can't process at that speed. And but she can perceive when they turn off and move away from her. So again, we look for things where she can thrive. There's another organization called Kids in Art based out here in San Francisco area. But since COVID, they have been doing virtual art project sessions. They send out a kit for your kid and everybody gets together. So things that support their abilities and their passions. And we just try to help them forget about folks who don't get you, because so many people just love her once she, once they know her. And so that's my advice.
Thank you. Dr. Willard, I had a question come in. It says, I know the data is limited, but I'm wondering if there's anything specific to kids with posterior fossa syndrome in the research.
Yeah, that's a great question. So there's not anything specific on posterior fossa syndrome and social skills challenges yet. Certainly, a lot of the kids that I'm seeing are kids with medulloblastoma who had posterior fossa syndrome, and so we're looking at that. But the numbers are small, so we don't have the data yet. Certainly, some of the behavioral or emotional dysregulation that those kids cope with when they are on treatment can be disruptive. I think too, some of the neurological and gait-based weaknesses that those kids struggle with, that is harder when it comes to social interaction. So that is also just a developing research base. It's a developing research base also from the neurocognitive perspective with regards to what posterior fossa syndrome how that will impact these kids differently. I think with anything with brain tumors, there's such a constellation of features that involve both the kid that they were coming in and then the different types of effects that each individual child is dealt because of their brain tumor. So no two kids are alike. But we are certainly looking at posterior fossa syndrome. So stay tuned.
Okay, thank you for that. Thank you. I'm going to throw one more at you, and then I'm going to go back to the parents. So professionally speaking, who on the brain tumor team would a family work with at their local children's hospital on their social concerns? Would it be a neuropsych, a psychologist, other therapists? Who do you advise they seek out?
Yeah, so I think there are a few different options. So certainly psychologist. I'm a pediatric psychologist. I get questions about social skills challenges all the time from a clinical perspective. So that would be a very easy person to start with. I think you could also speak to Child Life. They are great about social interaction and helping kids find each other. And so that could also be a great resource within a neuro-onc team. Who else? I think those are probably your two biggest ones. Neuropsych is going to be more assessment based. So certainly they would be able to help with an assessment and then working on an IEP. So working on getting social skills as part of that IEP. And then I think also just asking your neuro-oncologist, kids with brain tumors, there are so many that have social skills challenges. They may have heard of other kids. And so connecting, oftentimes if you can connect with another parent or another family that is also struggling with these challenges, it can help you find your people. And certainly a lot of support and problem solving and brainstorming among parents as I'm always amazed by what our parents can find. So they can be a great resource.
Thank you for that. Thank you. Lucia, how do you guide your daughter in awareness of social cues and appropriate interactions?
So we do it as they come up, and usually she'll ask me a question or something will happen on her way out of school, and she won't understand certain things. And so, it's interesting that Dr. Willard, you were talking about the facial recognitions and how she doesn't, or she'll misinterpret certain things. So I'll ask her to tell me what the scenario was. And then I'll just kind of name it. Like, she seemed like she doesn't understand, like indifferent, like she was indifferent or bored or whatever. And what that may be related to. So I'll go into detail about this person might be going through their own stuff. So what do we do with ourselves when that happens? And so that means we'll have to stop asking a question. We can find other things to do. So I guide her by teaching her maybe how to navigate that social situation, because she'll sit there and just feel awkward, or this person didn't respond, or a lot of the things come up also with cell phone etiquette, and asking and re-asking someone where she doesn't understand certain things. And so I'll just say, there's so many possibilities, but socially, this is how we respond. And sometimes that means we have to, we have to get to the understanding that they may not want to continue a conversation for whatever reason, but what do we do with ourselves and what does that mean? So that way she, because those things can hurt emotionally. Like, she didn't respond when I invited her. It's so different than talking face to face. So we go into detail about what that might mean, and then how to take care of her feelings, because she also feels pretty deeply. And so just kind of understanding the way the world works, I think, happens all the time, especially in the car for some reason.
It's a safe space with mom in the car.
Mm-hmm.
So thank you for sharing that. Jeannie, I'm going to ask you the last question of the day before we wrap up. My daughter has the initiative to join clubs and other activities, but cannot maintain the friendships due to her deficits. She's 13 years old and in middle school. Any suggestions?
Wow. My heart goes out to the asker of that question. We can't be there all the time, and we can't be there to coach real time or to give them suggestions of how to make it work. And I can say my daughter deeply felt the kind of rejection by her peers when she was boring to them. She didn't know all the in things and what was happening when the latest movie and all of that stuff. And again, I guess I don't have an answer for how you can help them stay engaged and have other people like them and appreciate them. All I can say is it gets easier when the child gets older and they start relating to adults more, because I find the adults have much more compassion. And when they find out Sarah's a brain tumor survivor, they say, oh, really? But she does so much and she's so capable. They appreciate her, in a different way. So I guess outgrowing it is my best advice, unfortunately, but that's why finding your people and where you don't have to be on guard all the time. Because the other factor is this is exhausting for our kids. They only have so much, mental energy and emotional energy and physical energy in a day. And if they use it all up trying to be popular, it's probably not a good use of their energy. And finding them a place where they can really be a star and shine in a world maybe isn't the normal track, but it could really support them and make them more happy.
Thank you. Thank you for that. Lucia or Dr. Willard, any final words before we close out today?
I would just echo being 13 is really hard, whether you are a brain tumor survivor or just a typical human. And as this child is trying different types of activities, it's keep trying, and maybe the first one isn't the first group isn't the right fit, but again, keep trying and finding other places, and maybe trying to find it with a buddy who can kind of hold her hand and take her with them. Sometimes I think that's helpful if you can just find one buddy. But my heart goes out.
One more suggestion I have, because it seemed like Sarah had a tumor-induced kind of Asperger's. I joined like Yahoo group or whatever for autism, and everything doesn't apply to Sarah, but there are sometimes activities or groups or things that Sarah would fit in well, and I just use those resources to the extent that they're applicable.
I think that one thing that I've found to be helpful, and of course we're still going through it, my daughter's a freshman in high school, but the other thing that's been helpful is that I've been a part of PBTF for some time now, getting to the other parents with kids that are going through the same thing, and finding that support with another parent has been huge for me. Because maybe they go through some things that my daughter doesn't go through, and so we support one another, and then our kids connect in some really nice way. That one of the things that my daughter doesn't understand is that reciprocity, like, hi, how are you, and then the conversation sort of dies, right? And so, but if both of them together are working on something or doing something, then they kind of enjoy that space together without the pressure of having to have this conversation. It's just connecting. So I feel like connecting with other families is really, really has been the best help and support for our family, for sure. So PBTF has a lot of groups and opportunities to connect. So I would stay connected with other families, for sure.
Thank you for that, Lucia. I actually am going to have our manager pop up a slide that shows some of the resources that Lucia was just talking about and some of those connections. So I want to say thank you, Dr. Willard, for your time today and sharing your expertise and your experience and your passion with us. And thank you to Jeannie and Lucia for providing such meaningful personal insights from your own journeys to the families today. I also want to thank all of the families, our colleagues that are out there today, our attendees, for your participation and thoughtful questions. The PBTF is here to help no matter where you are in the journey. So please don't hesitate to reach out to us. We are going to be sending a recording of the webinar, and we'll send the slides to you along with that at the email address that you registered with. We have several resources to help with the educational and survivorship needs. Our Survivorship Resource Guidebook provides comprehensive information and practical resources for survivors and families as you navigate the survivorship journey. The valuable resource can be requested in hard copy or downloaded online. Our virtual support groups for families that are 1 to 10 years from diagnosis resume next week on October 26th. And these groups are held every other week at 1 p.m. Eastern Time for 75 minutes and facilitated by a veteran parent. And finally, our family support webinars, the one you're attending today, feature carefully chosen experts with information and resources relevant to your journey. Past and upcoming webinar information is available on the website. Thank you again for attending our webinar today. And please feel free to reach out to the family support team at the PBTF if there is anything that we can do to help you. Have a good afternoon.